Welcome back to the show, everyone, and happy Thanksgiving. We're talking to Chase Bailey. Welcome to the show.
Thank you.
And you are a nurse practitioner over there at the Ogden Clinic.
Correct.
And we're talking today specifically about food poisoning with the food that you're not going to eat but leave out overnight by accident. Talk to us a little bit about that.
Absolutely. Well, Thanksgiving and in general, the fall promotes a number of different potential problems for families as it regards to foodborne illness. In particular, with turkey, we seem to have a lot of Clostridium perfringens, which is a bacterial infection that can happen from undercooked meat. In that case, we have antibiotics that are used to treat those problems. But the other problem is, families get together and congregate, and we all trade germs, and there seems to be more illness in general that time.
Instead of happiness.
Yeah, exactly.
How do you know if it's food poisoning or everybody just got the flu?
Yeah. So the term for food poisoning is fairly non-specific. There's a lot of different types of food poisoning. There's viral illnesses, bacterial illnesses, and to answer the question, how do you know you have it? And it's pretty obvious. Unfortunately, you have profound diarrhea, nausea, vomiting.
It's violent.
Yeah, it's usually
painful.
pretty uncomfortable.
Yeah. How should you treat it if you don't go to the doctor and you want to treat it at home?
So that's a good question. The main thing is staying well hydrated. I think that the utmost importance is to try to replace what you're losing. In particular, not just water, but things like that have electrolytes in them, so G2 Gatorade,
that's a good idea.
And things of that nature. The other thing is probiotics can sometimes help to bolster the immune system and the gastrointestinal system to get it back on track. You should avoid offending foods that make diarrhea worse and upset stomach. Like fatty foods.
Okay.
Basically, if people were to Google brat diet, B-R-A-T, it'll give you some examples of those bland foods.
Oh, that's interesting.
It's the rice and the applesauce. And
toast,
and
exactly.
toast and things like that. All right, how do you know when you should stop treating it at home and go in?
So that's a great question. If you have a high fever or your pain is increasingly getting worse or your symptoms are persisting beyond, say, 48 hours in that severe form, you should really seek medical attention. The other thing is people who have any immune dysfunction or a metabolic problem like diabetes or the elderly or very young, more likely to usher them off to the emergency room or to the clinic to be seen.
Chase, I often wonder when you do finish up with your day and you put the food into the refrigerator, how do you know when is the best time to be eating that and when do you stop?
Yeah.
Is it safe to do it?
Well, basically, the quicker the better you can get your food covered and refrigerated. Bacteria live on the outside of foods, and as we freeze them, that replication slows to a point where it won't cause disease. Between about 40 and 160 degrees, if a food's left standing, there's more likelihood of that bacteria growing. So to answer your question, quicker the better, I think.
So if you leave it out all day and people just keep walking by, know that there are little things growing.
So a grazing table we shouldn't be having.
Things are growing. Okay, any other Thanksgiving safety, healthy tips you'd like to share with our viewers today?
Yeah, I think that when you're preparing food, it's important to keep your meat and things that are uncooked, like vegetables, separate. Make sure that you're cooking your food to an internal temperature, at least with turkey, to about 165 or higher. And then make sure you wash your hands well. And if you're sick, stay home. Try not to be around your family members because you can trade illness that way.
Totally.
That's just a nice thing to do.
It is.
To not
or
spread
just
it
cancel
around.
Thanksgiving altogether.
No, you can't do that. You can call the Ogden Clinic and they'll give you more advice and help you feel great. That's their website right there, and we'll link you from ours. Go to goodforutah.com/midday. Happy Thanksgiving to you. Thank you for coming in.